name is Ron, I'm from the Little River Band of Ottawa Indians, and the word on Bay means let's go. So we're fortunate enough and excited to sponsor the rest this year, and we're going to do it next year too. So we're really excited about that. We're going to talk about healthcare. We had this part two. We started with part one earlier, and the opportunity that we as tribes have before us is everything needed to get into healthcare. We talked about earlier. We talked about the building trade or the opportunity to build a clinic. Some questions came in: is how do we fund these clinics? We talked about that through the 105 lease. We talked about 340B, pricing of drugs. We talked about what else? 105L, pre-award startups and the process of getting all that started. For the newbies that were there earlier today, if you have more questions today, please ask away. We're going to have some time today to answer all of your questions so it's clear and concise. So when you go back home to your tribe, you'll be able to help explain the opportunity, but then you're going to call us. So it's not a sales pitch, but we're going to talk about education and a bunch of different things. So thank you again for everyone being here. Why don't we start off with the introduction? Shane, why don't you start first?
Hello, Shane Urry, Vice President of Bay Health. Thank you.
I'm Martha Ketchum, CEO, owner and founder of Yoni Consulting Services. I partner with Home Bay and Base Rock, and I'm happy to be here with you today.
Can you hear me?
Yes.
My name is Marcia LaFleur. I am with the Kiowa Tribe out of Oklahoma. I am the Director of Behavioral Health, which oversees the reentry, alcohol, drug abuse, victim services, as well as the opioid response and suicide prevention programs. I'm also the Healing Way Director for our tribe.
And good afternoon, I'm David Sullivan, the Chairman for the Kiowa Tribe.
Thank you. Thank you. So how does the tribe do it? How does the tribe become self-sustainable?
Yeah, I mean, I think you can see on this slide, we wanted to try to outline those steps, right? In the first session, we talked about, as Ron alluded to, kind of the funding mechanisms between 105L, pre-award and startup, right? How does the tribe get started? What funding mechanisms are available in that capacity to help the tribe get there? But in this slide, it really identifies the steps to self-sustainability for a tribe. Obviously, the first step is becoming a tribal 638 clinic and establish that. Once does your tribe have a 638 agreement already in place? Is the contract? Are there ISDIA or 638 programs already established within the tribe? If not, what is it going to take to establish a 638? Those steps required, right? And I think that starts. Earlier, Chairman had mentioned in the previous session the importance of understanding what is required. From the communication timeline, what are the resolutions that the tribe needs to pass, and so identifying those steps and how to become a 638 clinic. And then once they do that, there's a whole variety of funding mechanisms, through the pre-award, through grants, startup grants and funding that we can look at that to help the funding aspect for the new established ISDIA 638. I can't read that far green one, but
Ability to market a high poverty area resulting in high eligibility of Medicaid recipients.
okay, yep. So obviously, by becoming a tribal clinic, a tribal designated clinic through the 638 agreement, that opens up to a variety of funding, a reimbursement, I should say, through Medicaid, Medicare, third-party insurance carriers. So getting contracted with those carriers, and then the development of the homegrown patient benefit coordination program, assist in enrollment in Medicaid. So what I don't think a lot of tribes know or understand is if you have a casino, there may be, I would say, a very high percentage of the population of workers because of, maybe they're part-time, maybe they've got large families, maybe they're younger. They may qualify for Medicaid, and so we take, it's important to take a look at those opportunities to enroll those patients and making sure that they are enrolled in one of those programs. And then the last one I think we talked a lot about in the first session was the 340B, the ability to establish 340B, taking advantage of the pricing. So these are just a few of the steps that on how a tribe can become self-sustainable and self-governing. Martha, do you have anything to add? Without you can't cheat.
And you want me to elaborate on which aspect of it?
Yeah, I mean, I think probably the first part, right? The importance of the establishment. I think the
establishing
process between, I think maybe Title I and Title V and how that operates.
Okay. Putting your clinic under the ISDIA, under Title I or Title V, is significant benefits advantageous for the tribe to put it under the ISDIA. Tribes just do it better. You have the opportunity to shape your healthcare to meet your local needs. And that's the purpose of the ISDIA, is to enable you to control the healthcare delivery for your community. Title I being, and Title V, the differences to consider in which direction to go. There are some distinctions. Title V is self-governance, and there's some criteria to meet. You have to complete a planning process to the satisfaction of the tribe. And secondly, is to meet those demonstrated financial stability through 3 consecutive clean audits. And then request to participate in self-governance with support of a resolution that your legislative body supports going to Title V. Title I is a little simpler to enter into. You have to have management systems to support, and you submit your proposal, and the agency has 90 days to review it, to enter into an ISDIA, and there's components to that proposal. That is a scope of work, the funding agreement, and the Title I contract instrument, and then funding tables. Back up a little bit, Title V requires a planning process, but you could also do one for Title I. And there's grants that support tribes to the planning process. That planning process should encompass reviewing all the components of a funding table. That would be your program dollars, your tribal shares, your area shares, your contract support costs, and if you want direct contract support costs, all those components fit together to meet a Title I proposal. And Title V is a compact. There's some distinctions between Title I and Title V, primarily in the autonomy of the tribe. Title V offers more autonomy. Title I, there's a little more control of the feds, that you have to report financial progress at quarterly, I believe, quarterly requirements. So as a Title V, you're only required to submit a single agency audit report each year.
So I think it was the list of questions we also often get, Martha, is how long does it take, right? So if a tribe already has a 638, how long does it take to amend? And then once that is amended, how long does the pre-award startup and that negotiation process take?
It all is contingent upon the tribe when you do your letter of intent, because that establishes that pre-award authorization. And if you submitted a letter of intent that you're notifying the agency you're intending to contract July 1, you gotta give the agency 90 days to review that proposal. And then you're negotiating by, if you want an effective date for October 1, you need to back it up 90 days, for example, and allow some negotiations back and forth. Then that negotiation can transpire, mid-September, let's say. You're giving the agency, it's taking their full 90 days to review it, and you can negotiate within a week, probably. It depends on how prepared you are. And that negotiation for the funding agreement and the funding tables is within maybe a half a day. It's the pre-award documentation, if you're going in for the pre-award funding, that takes some time. You make sure you have your invoices in, all organized and ready to go, and meeting the criteria of pre-award. And then you're negotiating the startup budget. That takes some time because you're estimating for the next 12 months what you're going to need for startup. And they have to meet the criteria of eligible categories of startup. And those categories are just negotiated. And when you negotiate that, if you're already within that day and a half a day for the funding agreement, and you spend another day going over pre-award and startup, and they may find some issues and give you time to respond, to clarify it, or provide more documentation. It could be 2 or 3 day negotiation, but once it's negotiated, what's one of the beauties of ISDIA is you get paid lump sum, payment for all of it. You get your reimbursement for pre-award, you get your lump sum for the estimated startup, your funding for program and area and headquarters shares. That's the beauty of the lump sum payment versus a grant, right? Grant, you have to do drawdowns and you have to justify your drawdowns, whereas ISDIA is lump sum. And I could go on and talk about ISDIA, but did that answer your question?
That did, and Martha always hates when I do this, but she's never gonna talk about herself, but she spent 25 plus years with the IHS in a senior level capacity as some of that as an area director, so she's very, very knowledgeable in this, and obviously the reason why I hand that mic to her so quickly, but go ahead, Ron.
Ron, I did have, I want to ask, does everybody know, because I was asked this earlier, does everybody know what the actual Bill 93638 is?
No.
Okay, so, great start. So let me explain this, and I'm going to simplify it a lot. It is the actual law that was signed in 1975 that said tribes have self-determination and the Education Assistance Act. And what that allows you to do is to run your own programs, your health programs for sure. And what used to happen prior to that was IHS, where they were the ones that controlled all of it. They determined what you received, how you received it, and who actually worked there. You did not have any control. When that was signed into effect, that we could go ahead and have those things, then if you were a 638 clinic, you actually control all of it. You control the building, you control the people, you control the services, the programs, the hours, the pay. You get to control all of that. So that's why we keep talking about that and make sure that it's important for you to know.
Let's break it down from the beginning. Some people weren't here earlier. Let's talk about, maybe Chairman Marcides can talk about everything that we need from the beginning, just to break down from within the tribe. There were certain resolutions that we want to do, right? We want to make sure that on the executive branch and the legislative branch, we're all communicating, no trouble BS, right? I need to say it like that. But we're all communicating, so maybe you guys can just mention some of the things that we want to make sure we're passed in the Constitution, your own tribal Constitution. So that way it makes everything run a lot smoother. So by the time we're documenting everything, right?
Well, I'll go ahead and just give I would say, a broad overview in terms of making sure from the tribal leadership's perspective that you have all of your stakeholders in the process. And it's even better if you could have this set up into a strategic plan process where it fits into something that's not just an immediate answer or immediate step to take for your tribe, but also it fits within a long-range plan and you have something in place. Not everyone has that, of course. We don't have that. It's a forming process. It's a developing process for us. But that requires being able to have the people, the team members that can put together and that you can put together and have them, start putting the steps in place to connect with your, as Ron was saying, connect with your legislative body or your council, whatever that looks like for you, and begin to connect to all the necessary steps that you need to have to make sure that you have the foundation in place, especially when it comes to IHS and what they require. You know, they want to make sure that it's not just one, it's being led by an individual, or it's being led by a particular branch or part of your government. They want to see that your whole council, your whole group is in one, I guess you could say, in unification or unified, and making sure that you're taking the step, because, you know, it's just a process that you need to have. And so, you know, I know in the earlier session we were talking about a checklist, and so you need to make sure that you have that in place, and have your executive team, your legal, go through that. And it's gonna be different for everyone, because you all have, you know, you have different structures, and your governments are set up differently, your councils, or whatever that would look like. So I'll turn it over to you, and if you have anything else to add or in more detail in that sense.
Yeah, I know a lot of, you know, not everybody has they don't have a constitution, that's, you know, that's not always, that is just something we have, but I know that there are tribes that don't have that. And when we talk about really looking at the checklist and making sure that you have all the players in that are in there, it really does delay setting up the process. It can delay negotiating with IHS. It can delay if you have to have your governing body approve certain aspects, even if it's doing business with non-natives, signing into contracts. You have to really look at what you have internally within your own sovereign nation and make sure that that list is there. The good thing about it is our partnership with OMBE, they were able to ask us the questions that we didn't know we needed to know at first. You know, it's not our specialty to start a clinic, of course we would have already done it. It is theirs. So the good thing is that they're able to step up and show those things to you and kind of give you more informed, make you have more informed decision making within your own tribe. But it is important to get all the players in from the beginning and get the buy-in early. As we know, you know, it's always political season in every tribe every year. So you want to make sure that everybody is on the same page for that, because it could be a profitable business for your tribe, but you have to have that buy-in from the beginning.
That was a great plug in for OMBE. So if you have questions or want that list or not sure where to start, reach out to OMBE, reach out to Shane here, OMBE Health, and we'll help you start that process, well, guide you that process better. Let's talk about, you mentioned, we were talking about, you know, the drugs and everything else like that earlier, and the opportunity with the 340B pricing. Just to make a plug in, earlier we were talking about drug Humira. Everybody heard of Humira? Sure. Right? So a lot of people around the country, they're paying about $5,000 to $9,000 a month on their healthcare plans for that drug. Our cost as Native people is only 1 penny. Isn't that amazing? So if I sell Humira to that patient, a non-native over there too, that's an $84,000 swing back to your tribe. That's amazing. So the goal is really just to get started. What rule or things do we need to pass within the tribe to be able to sell prescription drugs to the non-natives? What was that called?
You're talking about the 813 designation. So yeah, part of that process, as Chairman talked about, the checklist, right? Passing that resolution to expand your 638 contract. A piece of that is adding language, which is 813 language that we call it, which states that the tribe agrees to, and in this instance, the clinic agrees to serve non-native population, but never at the detriment of tribal members. So meaning that tribal preference will be in place, and so, hey. And so nice, checks the box. So that's the key piece of it, you know, as Ron talked about, is again, part of the checklist, making sure we have the correct resolutions, but what are some of the other things that we need to communicate, and the other opportunities really that are out there that make sense for the tribe, but not only bring better health care, better outcomes, but becomes a staple in the community and really leads healthcare within the communities in which the tribe serve.
Yes, and just to reiterate about the section 813, IHS will ask you for that. They're gonna ask you to prove it. So if your constitution, if you have a constitution that says that you have the ability to, you have a resolution or you have something, a law or something in place that's agreed upon by your tribe that says that you can serve non-natives, they want the actual, it's part of the process. You have to have that proof. So you can't just, one person decide if that's not what your constitution or your tribal membership agrees upon, your council.
Love that, because it forces the issue to make sure you got check.
Correct.
And that everybody within the organization is actually communicating. So why become a tribal designated clinic?
Yeah, I mean, these are just a few on the board here that talk about the benefit. Obviously, the 105 lease is what we talked about in the first session. You know, the ability for the tribe to be paid a lease on the property or on the building that they own to house this clinic, this pharmacy that falls within the 638 agreement. Or if the tribe does not own the building, they have the ability to go out and lease a building, which would be paid for through this 105 program. So that's one of the advantages. The other is the O&B reimbursement rate through Medicaid. You know, I always give the example of a standard Medicaid rate at a normal physician's office. You know, if you go to the urgent care, if you go to your primary care provider, the normal Medicaid reimbursement is probably around $50 to $70. But through a tribal designated clinic, they have a special relationship with CMS, which opens up to the O&B per diem rate of $826 per visit. So that's obviously a significant advantage of becoming a tribal designated clinic. And then the third is the 340B program. I think we've talked about that a lot. The tribe's ability through owning and operating a 340B pharmacy, not only for the benefit of the tribe and buying drugs at the lowest cost, but how do you incorporate that into your employee benefit plan? And having the 813 designation on the clinic allows your employees to utilize and you can incentivize those employees to be a patient of record at that clinic so that they can take advantage of, and the tribe can take advantage of purchasing those drugs through their self-funded health plan at those low costs. So it's not only an advantage for the tribe by buying those drugs at the lowest cost, but you can also set your plan design. Most patients on your health insurance, you may go to the pharmacy and you may have a $25 or $50 copay. Well, we can create, or you can create the plan design to incentivize those employees to go to the tribal clinic and to the tribal pharmacy by maybe offering a zero copay. And so it's a benefit to the end user, the employee, and or the tribal member as well. So these are just three of many of reasons. I think on the next slide it talks about a little bit deeper the advantages of becoming a tribal designated clinic. Anything else?
My answer for why we should be a tribally owned clinic is because it's our inherent sovereign right to do so. And that we make that decision for our tribal members in our community because we know our community's best. And I'm not talking about just our tribal members. If we're serving non-natives, we know our community. It takes a village. It's not just our tribal citizens that are affected by our clinics or not being able to go to a clinic. You know, there are people that have spouses or children that aren't enrolled, and they need to be able to have similar and, access to healthcare. Growing up, if you go to IHS and you're native or you don't have health insurance any other way, you have to drive or you have to travel, or it depends. There's so many barriers that were there or obstacles put in the way for you to do that. But as a tribally owned clinic and set up that way using the 638 and using all of the different things that we have, we get to decide what we do, and instead of letting the Medicare and Medicaid money, if you go through IHS, go back to the federal government, it comes to us.
Okay, as a federally recognized tribe, ISDIA offers several advantages, and we're only hitting on a few of those. The access to GSA pricing is another. The lump sum payment I mentioned already, but when you operate the clinic, you're entitled to ongoing indirect cost, 100% of indirect cost. As you recall, there's already been case law established from the Raven Navajo case with the IHS that entitled all tribes. That was an impacting case where you got 100% of your indirect cost. And that funding is for the infrastructure to support operating that clinic. That infrastructure is key because that supports your HR, your finance, your property, your acquisitions, all of that infrastructure that it takes to support a clinic. And that's part of the ISDIA. And we already talked about the pre-award startup part of the CSC. I won't go any more into that unless anyone has any questions on that.
But yeah, I think you can see from the slide, I mean, there's again many advantages from, you know, as Martha just talked about with, you know, the education funding, you know, special diabetes program funding, you know, having that CMS tribal clinic designation, you know, the list goes on, and the third party payer, you know, United, Cigna, Aetna, Anthem, you'll have that ability as a tribal designated clinic to be credentialed with those carriers at a very higher rate than again, a traditional primary care facility. So I think that, you know, again, a lot on there. Yeah, I think the next slide, Ron, really is my favorite, probably my most favorite slide, and I think Marcy alluded to this, right? You know, this slide to me tells the whole story of why a tribe should self-govern and start their own, you know, ISDIA 638, because it allows you as a tribe to put the tribal member first. It really builds a team around the tribe from an integrated healthcare model where, you know, because right now, you know, if you need to see a specialist, you know, through IHS, that may be a difficult or a different process than, you know, the tribe has that ability to really put the patient first, build a care team, an integrated healthcare model with a 340B pharmacy. So you not only will have a primary care physician oversight, but you also have a pharmacist with oversight, and those two are communicating and really care about you know, each patient and what's going on. The tribe will have the ability to coordinate care through specialists. You know, they'll own that process, right? Instead of passing the buck. And then, you know, there's opportunities to invest in nutrition therapy and food programs, and really integrating tribal health perspectives that are specific to your tribe, and investing in technology integration that's truly going to make a difference and impact in the life of each tribal member. So I love this slide. It's not just a pharmacy, it's not just a clinic, it's not just another health service. It truly is impacting and improving, again, not only the tribal member, but with that ability to serve the non-natives around you, you're going to impact the community, and a healthier community is a more vibrant community, and the tribe's going to lead the cause.
One of the other things we want to add in there too, when we talk about planning for the next 7 generations, you know, we start with healthcare, we're creating revenue, we're creating jobs, everything like that. But we're also investing into our youth, aren't we?
Yes.
We can take our youth person, if they want to become a doctor or a nurse or a pharmacist or etc. We have the opportunity to go to school to do all that. But then you get another $100,000 for them. The deal is they got to come back home and serve the tribe for 3 years. What a deal. And now you're really starting to change everything, aren't you? And you're bringing everything together, and you know what's interesting is that us working together, the theme of the Res Conference, you know, we're rising together, all of us together, we're diversifying our tribes from just not just the casino business, but now into healthcare. The casino business is about $80 billion, we have about 60 billion of that. But now we're taking all the tribes together, we all have this opportunity to get into the drug business, don't say it like that, but we are, right? But we have the opportunity to change everything, not only for our tribe, but for the community around us. We're taking the tribes, all of us, working together, and we're going into a $4.5 trillion market. That's amazing, think about that. When we're talking about the next 7 generations, what are we gonna do? Healthcare is that vehicle to do it. So you just have to get started. There's a lot of technical stuff, I'm not sure what to do, and ask questions. We're gonna have a Q&A here in just a minute. But ask questions. If you're not sure, the goal is just to get started and start talking about it at home. Talk to your leadership, make sure you guys are all communicating. We talked about changing some resolutions within your constitution. There's nothing worse than all of a sudden getting out to almost to the goal line, and then we have a fumble because someone wasn't communicating the right play. It's an amazing opportunity. So let's go to this next slide here. There's a
Hey Ron, could you say that about the children coming back to the community and working?
I can reiterate that a little bit.
Yeah, would you, that
One
was
of
a
the
powerful
things-
statement.
One of the things that we are doing, and that you know, if you work in gaming, funding that you create from gaming revenue has to come back to the tribe to create jobs and sustainability for your tribes. But this is similar to that, creating anything that you do to diversify your economic portfolio that you have. We have to be thinking about our 7 generations, and you have to create that workforce pipeline that begins with our younger age and the STEM students and everybody else. You know, in Oklahoma itself, my previous job was I was a hospital administrator at Cancer Research Hospital. 77% of our state is rural. We have 39 or 38, I'm not arguing, tribes, federally recognized tribes in Oklahoma, and most of them are rural and don't have access to health care. And one of the things that you can do, if you want to go in to get your, if you want to be a doctor, if you want to be a clinician, if you want to do behavioral health, anything else, you're gonna have to go and do your clinicals in a whole different town, possibly a different state, depending on where it's at. But wouldn't it be better to go ahead and invest that workforce pipeline that you're bringing your youth back to your own tribe and your own community so that you can build that workforce, so that you can keep those communities built up. The worst thing is of our youth is they don't have anything to do once they get there because the parents have the jobs. There's not any more work for them to continue growth. They want to do other things. So building this and putting that clinic in there that's a tribally owned, you're going to create the workforce pipeline that begins with our junior high STEM students going all the way through, getting their doctorate, doing clinicals in your own area and your own pharmacies, your clinics, your hospitals, and working through that. And then you get to invest back into your tribe and your community using, and don't forget, the anchor for your community is your Section 813 resolution. So you have to include that if you want to be sure and anchor everybody together.
Yeah, one thing that came to mind when Marcy mentioned that was one thing I don't think a lot of tribes know about, again, utilizing what resources are out there is the 105 lease. And the tribe has the ability through the 105 lease program for provider housing. So if there is a doctor, if we want to entice, if you are looking to, hire a provider or a pharmacist to your clinic or your pharmacy, through the 105 lease program, you can obtain either a lease or if the tribe already owns housing, the 105 program will help pay for the housing for that provider, for that doctor, for that pharmacist. So again, just a huge opportunity for tribes to entice those physicians, those pharmacists to come back home and or to come and work for the tribe utilizing this 105 program.
Now the self-governance that we talked about earlier, we talked about self-governance and the 105L. The self-governance is really looking at, it gives us the authority to go ahead and do that, but, the 105L gives us the infrastructure to do that. So that leasing is what's gonna help us, cover that infrastructure, where we don't have to put that back into programs where they were intended for the money that was intended for programs and services. We get to actually use them for the infrastructure using the 105L, and all the money we were going to use, we can put back into our tribe for those programs to build them back up.
So we mentioned earlier, like gymnasiums or sheds or all these other different types of buildings, right? You add up the square footage. So let's say, just for example, let's say it's if you take this building and this building and this building, let's say it's 100,000 square feet, okay? In some areas, you get $60 a square foot. Some areas you might get $30 or $40 a square foot. But let me use the better one, $60 a square foot for a minute. So you bring all these buildings together, 100,000 square feet, you get $60 a square foot. What's that? What, multiply that, 60 times 100,000, what is that? $6 million. $6 million every year. You don't get it for the first year. Well, you do get it for the first year, but you also get it the second year, and the third year, the fourth year. It's perpetuity. For the utilities, the insurance, everything. We have everything needed to get started, you guys. The goal is just to get started and talk about that, right? One of the things I want to add in here, what's really, really sexy, is that really cool, is that when you talk about building the clinics, right? The IHS will actually help cover the payroll. So the first year they're going to cover 100%, correct me if I'm wrong, 100% of the payroll, the doctors, the nurses, the IT, all that stuff. Second year, it's 42%. 42% of your payroll.
Depends on the tribes.
Depends on the tribes, right?
Martha's got some comments on that.
Okay, go ahead.
Yeah, that staffing piece is a sticky piece. It says that in the contract support costs for pre-award and startup has personnel as a category that's reimbursable, but they will go with codes to justify that personnel cost. And it can't be the program people because they're already paid through the program dollars, right? The program or area or headquarters shares. It's personnel that's, they claim as administrator, like a planner, tribal administrator. But then again, they'll come back and look at, are they paid out the indirect cost pool? Oh, you can't count those that are paid out the indirect cost pool. So it's always catch-22. So if you are documenting in that pre-award and startup phase, you gotta document well that who's in the meeting, sign a sign-in sheet, have an agenda, and I would purposely have that segment of the meeting for the hour that's focused on the project that you're implementing for health. If you're expanding or you're implementing a clinic, if you're implementing a pharmacy, have that agenda all focused on that. So that helps to document the staff time, the council time that they've spent on the leadership role of making those important decisions. And you're documenting that they're meeting on these issues. You can count that time throughout the year. Maybe you're meeting once a month, twice a month, even though that comparatively speaking to the federal operation, I would have a team comprised of all my CMO, my director of IT, director of contracting. All of those critical elements is going to help you launch a clinic. And we know that those positions are GS-14s and 15s, they're high-level positions in decision-making roles. So in your meetings, document that, their title, because that helps to elevate the cost. And they'll ask you for the cost of those council stipends or council costs each month to justify spending that in the pre-award and startup phase. So just food for thought there to keep that in mind. Documentation is key.
So Martha, we're going back home to our tribe. We've got this idea to build a healthcare clinic. We're gonna meet with our leadership. We start with that, don't we? Start right now and start documenting our tribe.
Yes.
Day one.
And all that time, while your leadership coming together to talk about everything, will be reimbursable by IHS. They're gonna say, well done.
So that's why I said get everybody that's involved, everybody that would have an opinion that's strongly worded, that could be for or against you, to be able to get this passed or to be able to get it moving forward, put them in the room from the beginning. Because that cost can be offset. And you're not having to go ahead, now, again, like you said, no double dipping, but still track it and still put that in there because you never know what you can or can't. When you do have a good partner, they can can come in and give you better parameters about what's being used based on what you have in the room.
What's amazing is that when you do these meetings, usually they actually document that. So now it's totally documented and eligible.
Ron, I'd love to hear from the audience. We've got about 10 minutes left. You know, these on the board, some of the typical questions that we get from you know, tribes and you know, council leadership that we work with. But what other questions? I know we threw a lot at the audience today, but what other questions may you have on this process? Don't be shy.
Can I ask a question about, you mentioned, I'm gonna go back to the youth question real quick, because that's kind of important to me. Will some of these dollars support the youth in internships, whether they're in junior high or high school, as they decide to go on to college and other educational programs where they can increase their resume and their knowledge of on-the-ground experience, and then be able to come back, whether it's pharmacist or whether it's other opportunities?
I love that. But that's,
But I'm thinking-
not selling on Bay, right? But part of on Bay is putting dollars into the foundation
Right.
to create those kind of programs.
Right.
We would all love those kind of programs,
Well,
right?
I'm thinking if you could do a dual program, whether it be junior high, for sure high school, and have college credits for kids that are already going to college, that would give them a big head start, and it would be a big confidence boost, I would think. So I was thinking of some of those dollars, whether it's KMRC or whoever, in some of the platforms you talk about, you know, I think I'm hearing the documentation is real important.
Absolutely.
Of your time and who's there, whether it's, you know, a planner, an architect, an engineer, whoever's in the room to get reimbursed. But there are plenty of kids who are just screaming to do something that are jumping out of their skin to be a part of something that they can have a passion for, and they may not know how to do it. And especially if you could encourage them to say, there's a reward here for doing it now. I don't know.
Well, you mentioned that, in where I was with the University of Oklahoma Health Sciences.
Right.
And one of the things that we have there with the health science programs, whether it doesn't matter what college it is, it could be dentistry, it could be psychiatry, it could be research, it just depends. What we have is through we have an actual program called the American Center for Cancer Health Excellence. And that is a tribally focused program that helps kind of bridge that gap between the two. They go in for the cancer prevention and control and community development. They go in and they have a YES grant that looks at junior high students and high school students to put them in programs into the summer for the labs. It puts them on campus. We have it from grade school for 1 day to junior high for a week to high school for a summer. And it ties them in, they get to work in an actual lab or a setting that's in the office, and it really gets them interested in it. And then they also can use that for their admissions as part of their admissions packet going into the university.
Well, you mentioned the schools like Oklahoma State University has a lot of programs for agricultural, veterinarian, farms and ranching and platforms where I think kids would be attracted to it. One, it could be great learning, but two, it's fun. And I think if you combine the two, that would really attract the right youth. So
We do work with OSU as well.
I would bet.
We do work with OSU because there is, where I was Stevenson Cancer Center, and we do have a hospital in Stillwater as well for that.
Okay, good. I think that's
Question
good.
there, yep.
So one comment and one question. I'm a physician. I'm on the board of the Association of American Indian Physicians. I hope that you guys will consider submitting an abstract and setting up a booth and figuring out how you can work with Native physicians that are actually feet on the ground in the communities to figure out how we can support a lot of these programs. I live in New Mexico and have recently been involved in a project that failed, which was a multidisciplinary clinic that was geared toward northern New Mexico patients, and of course that includes a lot of tribal patients as well, just kind of being in that community. And so my perspective is that there's, you know, the health monopoly in that area, that's not on tribal land, that wasn't owned in any IHS, but tribes could come together and create an entity to do these sort of things that you're talking about, I think, for a particular community. And so one of the specific questions that I had is, are you guys looking at surgery centers as well as in, you know, all of this whole smorgasbord of health that you're looking at?
For sure, for sure.
Yeah.
The goal is to start out with the clinic and pharmacy, then into behavioral health, and then add into the specialty services as well.
Yeah, I
The
think
goal is just to get started.
that's the beauty of the tribe's ability, right, to not only, you know, when you look at it, and again, I think I mentioned in the last session, but you typically think of primary care and pharmacy, but, you know, how do we look at behavioral health? How do we look at other specialties, you know, diabetes programs, cardiovascular, you know, and yeah, skilled nursing and surgery centers. So I think that's the beauty of the tribe's ability to self-govern. You know, is there an opportunity in the area for tribes to come together and build a solution that, you know, I'm from Phoenix, and so there's tribes, many tribes around the Phoenix metro. There's many Native Americans in the Phoenix metro, and I think there's an opportunity. Obviously, I just have the facility there, but you know they're limited to capacity and staffing as well. So I think it's just a discussion that needs to happen. But I think the beautiful part is that the tribe has an ability to, through self-governance, to do those things and really take charge of and ownership of leading the charge of tribal health.
That just made me think of something I think we forgot to mention on our checklist. You need to get with your city council and your community, non-native community, and work with those partners and make them partners and create that partnership with them as well, because a lot of times, starting out, you may not be on tribal land, you may be, you know, off reservation. In Oklahoma, you're probably off reservation, but if you can build that partnership with them, they may be the ones controlling the roads, the utilities, water, things like that. So make sure that you are also having that same conversation with them as well. So.
Yeah, it's a great point. I mean, the chairman was heavily involved in, you know, the city of Anadarko and what you were doing, but I think that's a great point to, you know, some of these areas, some of these cities and municipalities are struggling too. Now, I know a lot of FQHCs that are struggling, rural healthcare that are struggling, and again, the programs and opportunities that the tribes have aren't offered to those rural healthcare organizations, where the tribe has a tremendous opportunity to lead and stand up and be the leader.
One of the things. Okay. One of the things that, you know, in that same line, in that context, is making sure that your people understand how this fits, and it really does. You do need to make sure that you connect with your communities. For us, you know, in Southwest Oklahoma, our communities are drying up, and so we're connecting with them. We have MOUs with those cities, and you know, not just in this context, but others. We want to work with them to help make them smart cities or smart towns. And just be able to help with that infrastructure, not just in this capacity, but through, you know, we're looking at building up our broadband fiber capabilities. We're looking at a lot of other things, and so, you know, this is a piece that fits into the whole process of community development, regional development, and tribal land development. You know, not just here, you know, not in our area, but on a national level. And so it's important that you also make sure that your tribal members understand what this means in connection to IHS, and does it mean, well, what do we do now? I've had these questions. Does this mean we can't go to the clinic now? So I've been trying to make sure when I talk about it on my radio segments during the week, that I talk about that this is not taking away per se from IHS. You can still go there. You can still go to the clinic in Anadarko, but you now can go to this clinic and get better services essentially. But they can still have that option, and so, you know, the shares, we're not taking the whole, you know, we're taking a small percentage of shares from IHS. And so all of those things, you know, you'll have the whole gamut of questions from, you know, our legislators. One of ours asked that kind of question as well. So, but what I was saying earlier, this needs to fit within a large structure and a plan so that, you know, this is helping us move and get away from, or not get away from, but add to our current sources of income, which are primarily right now federal dollars and gaming and some tax revenue. And so this is going to give us just one more element that we can step up and move forward and just become more, move into that sovereignty that we want to see. And so, as Ron said, that's sexy.
I did just want to say thank you for bringing up.
Wait, Ron said he was sexy.
I don't know what he said, but I just heard sexy. I was going to say we need to turn the lights up because everybody's kind of saying some things.
Where's HR?
Yeah, we need HR.
No, I just wanted to tell you thank you for bringing up Native American Physicians Association. That's the other component that's important. We want to be treated by other natives as well if we can, if that's possible. And if you have a clinic or pharmacy or even IHS that's looking for something in your area, even if you don't have it set up, refer back to them. Look, that's where you can actually recruit and find native physicians there. And you were talking about working with different tribes. We are actually part of the Kiowas are part of the KIC. Is that right? KCA, sorry. KCA, Kiowa, Comanche, and Apache. So we're all lumped together in the areas that we have. So all of our, they're talking about shares. Technically, we could take all 100%, but we don't. From IHS, because they are designated for you. But we do have, because of those shares are distributed to multiple tribes, we have to work with them to be able to, they have to agree to going ahead and opening or using those shares and not taking away from them at all, or if we can absorb theirs. It's a conversation you have with other tribes in your area.
Right, there are a couple examples, like you just said, but Alaska Natives, they run their healthcare up in Anchorage, and you know, I don't know, they got 130 villages tribes, and they all utilize that. So there are examples in Northern California, it's Northern Valley Community Health, that's ran by 4 tribes, and they take the shares from the Indian Health Service. It can be done, but my question is, like, with the new administration, we got hit hard financially, right, with tribes. And the clinic was doing well, it sustained itself, it's profitable. I was looking into trying to get some of that money from the clinics to help the tribal organization. How can we do that? I mean, it seems like we can't make the health system economic engine for the tribe.
You know, two thoughts. I think for us as tribes, we have to, for many years, we lived off grants, right? And $100 million grant was a big deal when you had 4 tribes apply for it. Today we have 20 tribes applying for the grant. So we have to make a change. We go to the clinic side, but working the dollars that's earned from the clinic to get it over here to the businesses, that's what you're asking for?
Yeah.
That's gonna have to be something that can be worked internally within your own tribe, because it's your clinic.
Well, yeah, financially we got hit hard. I know there was one tribe in Nevada that had to close the doors because the federal government, the finances just dried up. So, and we were getting hit hard too, and that's what I wanted to do, was try to take some of that, make it more of an economic engine for the tribes instead of, you know, they're off on their own expanding.
Yeah, and I'd love to talk to you more about that, and just share again, passing the 813 allows us the opportunity to sell prescription drugs to all the non-natives too. Some tribes, we only have maybe 150 people, 300 people. How are you gonna sustain an entire clinic with just that? But by selling prescription drugs to the non-natives around us, and the community around us, it's a great economic engine for the tribe.
Ron, I think we're out of time, but let's go one last question. Go ahead.
I want to come back to a theme that the chairman was alluding to, which is for tribal members that have experience with IHS clinics in their communities. And they're trying to understand, okay, well, we have a healthcare solution. What is different about this? What would you share with them to say, you should be excited and want to be a patient of this model once you have the opportunity to be in it?
Yeah, I think the biggest thing that we talk about, and that's the number one question I always get when I'm before tribal council, tribal membership committee, tribal elders is, will I still have the ability to go to IHS? And the answer is 100% absolutely yes. We offer these as after hours capacity, right? So when you know, many of the tribes that we work with, their IHS facility closes at 1 or 2 o'clock on a Friday. Well, I've been sick on the weekend, right? And it's being sick doesn't stop at 2 o'clock on a Friday. So what happens at 9 o'clock on a Friday or 6 a.m. on a Saturday or Sunday? And these are after hours capacity clinics that the tribe has the ability to operate, which can serve the capacity instead of that tribal member having to go to the emergency room who doesn't know them, who doesn't care truly their number, and it's very expensive, right? I know, you know, you're lucky to walk out of an emergency room with less than a $3,000 bill. So these facilities, and my answer is always the tribe will have that ability, and the tribal member to yes, they can stay if they like their physician at IHS, stay there, but know that when you need to go, when you need to go to that facilities in an after hours or weekends capacity, you're going to be taken care of. And we have ways and ability to communicate back to their primary care physician to making sure that they understand what care was provided. And I think the biggest thing is, how can we work hand in hand to ultimately, it's providing the best overall care for the patient. Back to that, my favorite slide, how do we create an integrated model where IHS is a part of that, and we're communicating and we're providing the best outcome for each patient.
So I'm gonna add the tribal side to that. When I get asked this all the time, where I come back in and say, I can give you the numbers, I can give you all that, but really what makes a difference is the money's coming back to the tribe. We are building our own sovereignty. If we are looking outside of the tribe for resources, how are we supposed to remain sovereign? We have to be able to generate that revenue for ourselves. In addition to that, we can add in any cultural, appropriate wellness, healthcare that we want because it's our clinic. If I want to go and somebody wants to, if they need to go sweat, they need to go cedar, they need to get their blessing, whatever that is. If it's different things, it just depends on the holistic approach or the modern Western medicine, how you want to approve that and what you want to tie in. So it really depends on how you set up your clinic and your pharmacy or your entity, because you can make it more culturally relevant and everything else that you have that makes it a difference, but it also puts it in that revenue is coming back to our own tribe.
Yes, that's a great point on the alternate resources, third-party collections to sustain your program. One of the advantages of an ISDA contract is that you have the ability to collect at that O&B rate, but the other thing is that it's carryover funds. If you have a balance at the end of the year, you can carry it over to the next year without asking for it. As opposed to a grant, you have a grant, you have to continue to ask, can I carry this over, and get permission. But whereas the ISDA goes, it's an automatic carryover, and you don't have to justify it or request it. So if you have those alternate resources, manage it well and carry it over. That's what will sustain you.
Thank you, everybody. Appreciate your time.